Hi, this is Dr. Ajay. In the previous video, I have talked to you about a diagnosis of HIV and the various tests that are done, and I also spoke briefly about HIV. In this video, I would be talking more about HIV treatment, the side effects of treatment, and the follow-up of the patient. So once the patient is diagnosed with HIV and we subject the patient for further CD4 and viral load, the latest guidelines, that the DHHS guidelines and the WHO guidelines state that you don't have to wait for the CD4 count to drop. That means if the patient is HIV positive, you can straight away start HIV treatment without waiting for the CD4 counts. Okay. So after the patient is prepared for this HIV treatment, the counseling is done. Then you have to assess the patient whether the patient is ready to start the treatment. You have to do preparedness counseling, and we usually start the 3-drug regimen, which is very popularly known as antiretroviral, combined antiretroviral treatment. So in this, we give the patient 3 drugs which are combination. So once when we start the treatment, we also monitor the patient for the side effects of the treatment, because not all ART medicines are free of side effects. So we choose the regimen which has the least side effects. So for example, if the patient is on zidovudine, we monitor the patient for any signs of anemia, weakness, fatigue, or nausea. Some patients develop loss of fat, which we call lipoatrophy and lipodystrophy. Then there are other side effects like tenofovir causes renal kidney function, deterioration of kidney function. So like this, we monitor the patient. Some people taking atazanavir can develop yellowish discoloration of eyes. So we tailor made the medicine to suit the patient. So when we start the patient on antiretroviral treatment, on every follow-up, we insist the patient to take the medicines regularly, because adherence is the most important step in the success of antiretroviral medicine. The tests that we do in the follow-up are again the baseline functions like his liver function, kidney function, and we also assess the CD4 and viral load at the end of 6 months. So by doing these tests, we will know whether the patient is responding to treatment or not, and we will also know whether the patient is developing any side effects to the treatment or not. So by this monitoring at every step, we also counsel the patient for adherence. So the treatment of ART, by taking ART treatment, it also helps in preventing the HIV transmission. For example, if a patient is, if a couple are HIV positive, one is husband is positive or wife is negative, or vice versa, what we call discordant couple. In them, if one of the patient is using antiretroviral treatment, by decreasing the viral loads to undetectable levels, we can also prevent the transmission of HIV from one partner to the other. But we also recommend the patient to use condom. There is an option of taking HIV medicine for preventing HIV, what we call as pre-exposure prophylaxis and post-exposure prophylaxis. Here, if the patient accidentally has a needle exposure to a HIV positive patient, or if the patient has any sexual exposure, then immediately after the exposure, he can take medicines within 72 hours. By taking these medicines for 28 days, he can prevent HIV transmission. This is what we call as post-exposure prophylaxis. Then there is another other entity called pre-exposure prophylaxis, wherein if the patient is getting involved in high-risk activity, like for instance, most of the sexual workers, they unknowingly they meet many partners. So to avoid getting HIV infection, they can take preventive treatment. This is again taken for 28 days to prevent HIV HIV transmission. So you can always consult me through Lybrate, or you can directly consult me in my clinic at Hyderabad, Narayanguda. Thank you.